Okay, so now we go to our esteemed doctor, Dr. Abdullah Al-Baghdadi, who for you, I suppose, doesn't need any introduction. And I hope that those of you who had missed the part one, we have already sent you, and you have been able to um, see or watch the program last time. But this time, Dr. Al-Baghdadi, who is the research physician at Medical University of Graz in Australia, how do you pronounce Graz? Is it Graz?
Assalamu
Yes.
alaikum. Yes, you can say Graz. It's okay. Yeah.
Graz. Okay,
In
in Australia.
Australia.
Huh?
In
Sorry?
Australia, not Australia. Little bit closer.
Yes, in Austria. Yes,
Sorry.
it's not Australia.
Yeah.
So yeah, so now we are going to have part two, inshallah, and without further ado, I shall pass you on to Dr. Abdullah.
بسم الله الرحمن الرحيم والصلاة والسلام على سادة الخلق محمد وآله الطيبين. السلام عليكم جميعا ورحمة الله وبركاته.
وعليكم السلام ورحمة الله.
First, this part will not be disclosed from the other part, as the topics I mentioned in the last part is really important. Some of them I will mention them, but a little bit quickly, without details. Others I will go a little bit in more details. So to have like some gathering for the information and also deep in the important informations. So as we mentioned in the last meeting, last session, that our core biological life side called metabolism. Metabolism is when what happens inside our cells to change or convert what we eat, what we consume, together with the presence of oxygen to energy. This process maintains our life. So our life from the biological side, it continues with metabolism. So this thing as essential and important that it is like the oxygen for our life. Well, oxygen is part of this process. Any disturbance for the balance of metabolism will disturb indeed our life. Indeed, everything we need, even in this universe, depend on balance. The oxygen or the air we inhale, it is not like without any ratio. Can't change the percent of oxygen in the air. Otherwise, it will disturb our organism work. If you see some people who go for high mountains, especially if they're not adapted for these places, they will have some problems, especially till their body adapt for that high altitude or heights. So the core of our health come in this balance. Indeed, what affect our metabolism is everything we have, our mental health, our nutrition, medication, and what we smoke, what we do as exercise, as physical exercise. And also there is another aspect which called the microbiome, the good bacteria inside us. This also call it legs for our balanced health. First, I will start with the mental health just shortly. It is not my specialty. I'm like research physician, not psychologist. But I will bring one aspect is as too important. Then I'll talk a little bit about the nutrition, and I'll bring the most important topics in that. Then in the end, I will just talk a little about the exercise. Microbiome, it needs its own topic indeed. It's too big topic, but I will just give an example. I mentioned last time that in our experiments and our studies, one study examined that we brought obese mouse. We took the microbiome from this mouse, like transfer it to a healthy mouse, not suffering from like overweight. After a month, after a month, this mouse, the new mouse, the healthy mouse, become obese again, just by transferring the bacteria, because it is part of our metabolism. We depend on this bacteria for many ingredients and particles that we need for our health. Even if you see, like when you take some antibiotics, you may get diarrhea, which is because as a result of disturbing the microbiome by the antibiotic. Antibiotic doesn't disturb our body, but disturb the bacteria, and that lead to diarrhea, which is a physical problem or health problem. I will start with the mental health aspect. I will bring it like a story. If you remember the BMW from the last time, let we imagine that today is we gathered in the Husseiniya for Farhat al-Zahra, happy day of Sayyid al-Zahra, and everything fine. We celebrate, laugh together, had a tea, eat some sweets, everything perfect. Then we are like finished back home in the BMW, and also we feel relaxed, everything fine. Once suddenly a cat jumped over the road. Like, I saw the cat, I panicked, I don't know what to do. I can't go right, there's a car, I can't go left, I go out of the road. I just really panicked. The poor cat also panicked. I pushed the brakes, the car stopped, it's BMW, good brake. So I just realized myself, I breathed quickly, my heart beat speedy or fast. My body all like gets like rigid, spasmed. What happened here? Why just suddenly everything happened at once in my body? We have inside us what called autonomic nervous system. This nervous system which work automatically to balance our organics and also our part of body. It makes the balance inside. When this system revealed or feel that we are in danger, there's any risk, any danger for us, it will activate the sympathetic division, which called division of fight or flight. It is the best division for the soldiers. Fight or flight. When you feel like there is risk or dangers for yourself, for anyone of your family, it will be automatically activated. Indeed, we need this one to protect ourselves. So what it will do, it will give order for your heart to beat quickly, order for the lung to work faster. So you will have fast breathing, tachycardia, fast heart beating. It will give order that the blood should go more for the extremities, for your legs and hands, as you need it for fight or flight. But it will decrease the blood flow for your digestive system, for your stomach. So it's not time to digest. It will decrease it even for the logical thinking, for the cognitive thinking, for your brain, big part of the thing, it will be decreased. Your immune system will be decreased. So it is not time of infection, fighting or something. You have to do a physical fight. In the opposite, we have what called the parasympathetic division. It's called rest and digest. When we sit, when we are in Hosseiniya, or now we sitting here talk, it is a rest situation. So the autonomic or automatic, let me call it, nervous system will shift to the parasympathetic. Parasympathetic said there's no danger, so give order for the heart to work normally, calm down, for the lung to calm down, give more blood for the logical thinking in the brain, to the immune system to work normally. Everything will be stabilized. When I'm sitting here, I'm thinking about like there's like a pandemic, I may go out, then I get infection, then I may get sick. When I go this thoughts, my body will feel there's some danger. It will activate automatically the sympathetic division. I'm sitting here, I'm not having any fight or fly, like I don't have to rush or to run away. But this activating will make me ready for such situation. But the problem, I'm sitting here and not moving, not doing anything. So as I'm just sitting here, my immune system will be inhibited. My heart will be receive order to like beat faster, breathe faster. My cognitive thinking will be decreased. So just like burning inside me. This what happen when usual what we do, we bring some from the past, some thoughts, some memories about ourselves or others, and make a connection with it for the future. Like for example, once I had a patient, he was COVID patient, he called me, he said, I can't breathe anymore, I'm dying. Like he had a mild situation. So I talked with him, I said, like, there's nothing from physical side. I said, what happened? He said, I was like looking in the internet and I saw a guy who died in COVID. So I was sitting and I imagined like my situation get worse. Then I died. Then I looked for my kids, became orphan, that they are poor, they don't have food. He was sitting in himself and he moved in his thoughts to that aspect. His body automatically activated the sympathetic nervous system. He panicked, he couldn't breathe anymore. Everything disturbed just by thoughts. Indeed, most of the time we activate our sympathetic nervous system for no reason. Like we think about our family, about economic problems, political problems, any of those. Just by thinking, this will activate this sympathetic nervous system and we are in our places. And the result, what we mentioned, the activation, what called activating for the stress, which activate the stress hormones, which is adrenaline and cortisol as major, which, as I said, did inhibit the cognitive ability, immune system, digestive system. As a result, all what we mentioned. So how to deal with that? Like many said, yes, I know there's problems. This is life. I can't be like careless. I should worry about my family, my friends, myself. Her psychologist give a nice advices. How to control it, how to keep it under control, how to not let these ideas, thoughts be controlling you, that you control them. There's a few tips. The first one is very easy and very like useful. First, to divide any problems, any thoughts which may make us worry is in two divisions. One, do I control this thing or not? For example, about the pandemic now, as an example, a life example. One side that, for example, people don't take their care about protection, like wear mask or something. Can I control that? Indeed, no. So thinking about this problem will not help me. There is economic problem now. If I'm thinking about that, will that help me? Will I be able to control it? No. So indeed, thinking about this problem will take me for activating the nervous system without doing anything. It will take me for continuous activation for the feel of danger or feel of risk. And the opposite side, we have things that we can control. Like I get now sick, I can't control the complications or what may happen in the future, but I can control that I take medications, take the advice of the physician, or anything that I can do it. If I give my focus or bring my focus on things I can control, first it will take me away from things that I can control, which is waste of time and energy and also bad for my health. In the same time, when I will do these things that I can control, it will make me feel safe. It will shift automatically the body for the parasympathetic nervous system, the rest and digest, because your brain understands that there is no danger anymore. You solve the problem. You say you did what you have to do. So this is tip number one. The second one is very useful and very practical. As we had in the beginning, the BMW. I will take the three letters from this car and bring it here as nice example. B for breathing, M for mindfulness, and W for walking. As we said in the beginning, when the sympathetic nervous system being activated, your heart will beat faster, your lung will breathe faster. You can't control, can't do anything for your heart. You don't have control over it, but you have a control on your breathing. You can slow it down. Indeed, when you slow it down, that you take deep breath and slow deep breath, then you will give an order for the brain that it is not a dangerous situation. You are not in dangerous. So this will automatically push the brain to switch from the sympathetic nervous system, fight or flight system, to the parasympathetic nervous system. And this is very practical, and many may try it. Like when you just get rash or like feel unstable, just take like 5-10 times deep breath. You'll feel amazing calm. The second one, the M, for mindfulness. As we mentioned, when we go, like when we worry, what happened, that we bring some like memories from the past, our past or others' past, something happened in the past, and we connect it with the future, and we make our scenarios that we are out of the present, not in the present. So mindfulness to come back for the presence. Just I'm sitting here, be mindful for I'm sitting here, what around me, which voices beside me, just to get rid of the past and future connections. This will take you out of this continuous worriness or worry thinking. The third one is walking, and walking here will work with what we mentioned in the begin, that these two hormones, stress hormones called adrenaline and cortisol, their job to make you like fight or flight. It will make you active, physically active. So if you leave it, if I'm just keep sitting here, it will keep burning me from inside. It will do something, run or fight. So when I walk, indeed, I will absorb them. I will use them. So then my body will relax again. This is theoretical advices. Let's put on in words in practice, in reality. As we did last time, it will take with us about 3 minutes. We would make breathing and mindfulness together now. All what I will say is keep stay with the words. Don't go behind it. Don't go deep to analyze the meaning of what I'm doing. Just take our work now just to get rid from the thoughts, from activating the brain. We want just to feel the mindfulness, the presence we live. So I will start by asking you to close your eyes. It will be better if everyone have something behind him, behind the back. Close the eyes, please. I will start with breathing. Take breath in, breath out. Breath in, breath out. In, out. Keep your mind and your attention with your head. Fill your head with your attention and without thinking. Move your thinking and thoughts to be with your back. Feel the attachment of your back to the chair behind you. Move your attention to the chair down and feel the attachment with the chair down. Move your attention for your legs, your foot, and its attachment with the floor. Move your attention to your knees and just feel it in your mind. Move your attention and your focus to your belly, your stomach. Put your hand over it and feel it when it moves with the breathing. Move your attention and your focus to your chest and feel it how it moves when you breathe. Move your attention and focus for the sounds around you, which voices around you. Now let your mind think freely anything it wants to think about. You just keep watching for the thoughts. Imagine like it is like a clouds. Come and go, come and leave. Just watch your thoughts and let your mind think anything it wants. Now bring your attention back for your breathing, for the breath when you breathe in as it passes the air pass your mouth or nose to the throat to the lung how the lung extend with the air, then the exhalation, the breathing out, how it goes back out, in, breath out, breath in, breath out, breath in, breath out. Now open your eyes just for 10 seconds. Feel the difference. 10 seconds. So what we did already, we brought, like, we pushed our autonomic nervous system to be, usually it is partial, like it is, for example, partially sympathetic. So we push it more for the parasympathetic nervous system. I feel now like some of them feel very relaxed. Some of you maybe want to go to sleep, just feel just relaxed. Like, so imagine now this amazing feel, amazing rest and relaxation. You had it for just short time, but if you do it every day, like 3 times, like I would just like for Dhuhr, for Maghrib, and before sleeping. That easy. This will make your parasympathetic nervous system is the default system, the main system in your body. So you will be more calm, more relaxed. I had some of my patients, she was lady like about 60 years old. When she like started with me, the first problem, she said, since 5 years, I never slept continuously the whole night. I had to wake up minimum 5 times per night since 5 years. So we start the program, and one of them, I asked her to do this like exercise 3 minutes, 3 times a day, as I mentioned now, 12 o'clock, 6 p.m., and before sleep. After 3 days, she said me, since 5 years, tonight is the first night I slept in the night and woke up in the morning. In the just third day. So it will bring you even sleeping, because when you are in the war, for example, soldier in the war, his body saying to him, don't sleep deeply because you might be in danger, yeah? So when you activating your sympathetic nervous system in fight or flight mode, your body don't want you to go deep in sleep, in your sleeping. It will keep you aware if any danger may happen. So that's one of the major reasons that you don't go deep in your sleeping. When you activate your parasympathetic division, the rest and digest, your body will say, no, go deep, take rest. So imagine if you apply this. Many said, yes, I am so busy, I can't find. Indeed, just the first 2 weeks, if you keep it as a habit, then you will have it every day. You will not miss it, especially if you're connected for the prayer, like 10, 15 minutes before prayer, even you will feel much better, more focused in your prayer. You can give more attention for your prayer. You'll feel your presence. So this is the mental health part. Sorry if I took a time more than what I should take. I will go for the second part, the nutrition part. Indeed, as it's important that we have usually two types of, we can classify disorders and disease in two divisions, chronic and acute. Acute when we have something for a short time, chronic when we have something for a long time. Acute diseases need stable nutrition for about 40–50%, and then 50 to 60% medications. But for chronic diseases, you may need 60 to 80% good nutrition and 40 to 20% medications. And the best example is diabetes, heart, hypertension, and other chronic diseases. I had already 2 patients who joined a program, and this was a big part of it. After 6 years of diabetes, of taking medications till they are reached close to insulin, just in about 1 month, they reach the level that they don't need any medications, any drugs, with stable glucose in the blood. And they are already 2 months without any drugs, without any medication for diabetes, just following the program what we mentioned now, but of course adapted for them because they are diabetic. This is a little bit more general. The first tip, which is very easy and very practical, and will give you indeed a rich advantage, that when you eat, don't eat from open buffet. Take a dish, big dish, put everything you're gonna eat. With the time you will know how much you will eat, that you will eat it all. This dish should have or has 50% fruits or vegetable and fruits, better more vegetable. Half of it vegetable, salad, like sauce or this baked vegetables. 25% of it, a quarter of it, will be protein. 25% carbohydrates. When we say protein, we mean chicken, fish, meat, beans, dairy products, milk products, cheese. When we say carbohydrates, we mean like bread, rice, pasta, potato. So rice or bread or potatoes should be 25% of this dish. 25% meat or chicken or like protein source. 50% should be vegetables. It's okay to have 1 fruit or 2 pieces of fruit if you're not diabetic. Diabetic, better to have 1. If you apply this like small thing, you will have a great advantage. You will have no stabilized metabolism. You will not have mostly you will not have problem with like constipation or something like this with your GIT, gastrointestinal nervous system, gastrointestinal system or tract. You will have balanced diabetes or sugar if you are diabetic. Even your like hypertension, if you have it, will be stabilized. The second tip is to eat more what we call complicated carbohydrates. Like if you eat bread, to eat brown bread more than white. It's okay to eat no bread or no rice, but when you eat, shouldn't be more than 25%, and eat like we call it rich in fibers. Why? When you eat sugar or white bread, when it will go very easy and fast in your blood. Imagine this diagram. Here, this line is what your body needs. When you eat sugar, like sugar-containing food or white bread, it will go very fast that in short time, it will exceed your need for the sugar. So it will disturb your metabolism, it will shock your body. Then after a short time, it will drop down. But if you eat fiber, uh, rich in fiber food, like more salad, more like a full, we call it full corn or whole grain, like brown bread, it will be very slow metabolized, like the yellow curve. I feel some of you are already tired. I'm already close to the end. Another tip is very easy, that try to apply what called Mediterranean diet. It is like from the name of Mediterranean Ocean. Very few tips from this Mediterranean diet. One, keep olive oil in all your meals. Breakfast, lunch, dinner, minimum 1 spoon of olive oil. Even you can cook with it, but you should put not high fire. For example, just suggestion, it will be okay if you eat once or twice a week fish, once or twice a week chicken, more than that vegetables. But better to keep the red meat once a week or less, not more. This is also easy tips. Indeed, it found the best diet regarding the type of food or quality, not about the quantity. The Mediterranean. There's many research proved that. Today, I will give more focus for this topic, the intermittent fasting. As Herjiraj said today, give us some tips to keep us young. First, I will talk about one study. It said that they studied the effect of growth hormone in people over 60 years old. Indeed, what happened after 60 years old? Your growth hormone will drop. In this study, they about two groups. One group, all of them over 60. Usually after 60, your growth hormone will drop by down like 50%. If it like was 1,000, it may come for 500 or even less. In one group, they give them more growth hormone, artificial growth hormone. The other group, they keep them without any change. So in the group one, they give them a growth hormone to make it the same like young people, like someone by 35 years old. What happened after 6 months? Those in group one who receive growth hormone, they have increased lean body mass, more muscles. They had thicker, or the skin thickness was thicker like normal people, like young people. Your bone density become richer like young people. The adipose tissues, the fat, decreased. This is in group one who received growth hormone. The second group who didn't receive anything, they had the opposite. Your muscles start to shrink or decrease. Your skin start to be lighter, more tender. Your bone density start to be weaker, more weak. Your adipose tissue start to increase. So does it mean we should receive growth hormone? Indeed, no. When we do intermittent fasting, we increase our growth hormone about 5 times. We will reach the same advantage and benefit just by intermittent fasting. Isn't it amazing? So what is what is intermittent fasting? So it is very easy. Indeed, it is very close to the Islamic fasting, but little bit easier. So many ask me, can I do it like the Islamic fasting? Indeed, no one can, or most of us can do an intermittent, like Islamic fasting every day for the whole life, yes? But I advise them, like, if you like, you can make twice a week Islamic fasting, and the rest, the other, like 5 days, you do this intermittent fasting. What is the difference? With intermittent fasting, we eat in the daytime for 8 hours, and 16 hours we fast, but part of it will be the night. For example, I will have my first meal at 12 o'clock at noon. This will be start the open time for eating. The last meal should be before 8 o'clock, 8 p.m. After 8 p.m., I will start fasting till the second day, 12 o'clock, which will be very easy because a few hours like before sleeping, it's okay to fast if you like don't eat for 4 hours. When you wake up in the morning, it's not difficult to stay till 12 o'clock. Yes. Plus, within this fasting time, you can drink water as much as you can. You can drink tea. You can drink coffee, but it should be without sugar in the fasting time. In the 18 hours, it's okay. I think other options like this, in this one, this example I mentioned, this is many ways, of course. I mentioned that you will just miss breakfast. You will not eat breakfast. You will have, like, you can have tea or coffee, pure tea or pure coffee or water till 12 o'clock. Then you'll have your lunch. Till like you may have like 5 p.m. something light. Then 7:30 you can eat whatever you like. Just we keep the ratios as we said before, 50% vegetables. Then from 8 o'clock till the second day, you are fasting, but you can drink water, so you will not feel really hungry. And it is very common that when you apply this diet, after 3-4 days, you will have very normal and even good appetite or weak appetite that you don't feel that you want to eat. Your appetite will calm down. And this is very good advantage, this effect of the what called ketosis. Those who apply it as with diabetics, it enhances their diabetes in strong way that some of them reach that they don't need medications. It have amazing effect against hypertension and even against cancer. You will feel your body more active. You will feel your attention and focus much higher just by this rules. Is it easy?
Could be. Could be.
Yeah, just eat from 12 to 8. You don't have to like be fixed for this time. You can eat like from 9 a.m. for example till the last meal should be before 5 p.m. You just have to keep it for 8 hours. So move it as you like. By Islamic fasting, indeed, we do the same. We eat at night 8 hours and 16 hours, but it will be with even fasting for water, which is it can be a strong advantage, but little bit maybe not easy for everyone, especially those who can't drink no water. For more details, maybe in the question and answer part. I'm already finished with the nutrition. I will talk in 1 minute about sport. Very easy, very nice tips. First, keep at least 5 days a week. you have two options. One, to make home training, home exercise, 10 to 15 minutes, or 30 to 40 minutes walking. Better to have them both. I think it's not difficult for most of you if you can. If you have problem with your legs, you can do it on like some exercise for your upper body. If you have problem with your hands, you can do it. You can find the way which good and easy for you. If you have some like health problem, you might ask your GB for the best way. All what we mentioned, especially intermittent fasting, I talk with you as I know most of you or all of you. Exceptions, of course, it is not good for everyone. We can't recommend children to do it. We don't recommend pregnant women or breastfeeding women to do it. We don't recommend women in special like menstrual periods. They have to contact their gynecologist, or if they have contact with me, can ask me. So, or they may fast for just 14 hours. The other women, but not pregnant and not breastfeeding women. I'm finishing with the word from Amir al-Mu'mineen: don't make your stomach a cemetery for animals. I mentioned that it's very amazing tip. I apply it in my life. My main part is already the lecture finished. Maybe time for like few minutes. I don't know how much we have for question and answer.
Actually, the time we allocated has finished, but please, because we don't have you so often, I would like to extend this time to 12 o'clock. So if there are any, what I'll do first of all, I'll unmute everyone.
I will start questioning. I have one question.
Yes.
From the last session, did anyone apply some of these tips or advices we may talk about?
I did.
Good. We had one like.
I don't know about others. I haven't seen anyone. Has anyone applied? Yes, Noshi?
Yes, I have. I do my 16-hour fasting.
Perfect. Alhamdulillah. Yes, Herr Hussein.
I got two sport questions. One, at night time, not every night, but occasionally, my mind become very active, thinking something here, from there to there, and this night become very distant. On the first question, my first question is, at night time, occasionally, my mind become very, very active. First, mainly after a Subha prayer, Salat, I can't sleep. Mind become very active, thinking of so many things, and then I can't sleep properly. Second question is, I don't want to skip my breakfast, but if I take my dinner at 8 o'clock and skip my lunch, will it be okay?
Like one, if you will have your breakfast.
Yeah.
Yeah.
And then I take my dinner at 8 o'clock, but I skip my breakfast or lunch.
So when you will have breakfast?
About 9:30.
9:30. So the last meal you should have about 4:30.
Oh, I see. Oh, need 16 hours.
So to have 8 hours of eating window and 16 hours open. Indeed, so regardless the name, if it lunch or dinner, just have something in the middle. You will have some other option that your breakfast, make it just tea or coffee. Just try it. Previously, they said breakfast is important. Indeed, it is important, except if you have dinner. If you miss breakfast, it's absolutely normal. I don't have breakfast. In the morning, I have sometimes coffee or tea. That's it. work properly, and it's amazing, very effective, because it keeps your body fasting. So either you have or what you can do as balance, 9 o'clock you have tea or coffee, 10 or 11 a.m. breakfast, then after like 7 hours the last meal, then when be 8 hours you are fasting for the next day. Just keep it within 8 hours. Before, for the like sleeping problem, going in sleep, do this like mindfulness training. We record it. We will send you the record. You just can learn the train. We make a body scan, like head, back, pocket, like a back, lower back, food. Then we come back. When you put your mind with these parts, you switch your brain from thinking by memories and future to the presence. You feel the mindfulness. Believe me, 3 to 5 minutes, you'll go sleep. Better to do it on bed.
Thank you, Dr. Abdullah.
You're welcome. Yes?
Yes, Zulfikar.
Doctor, you know, when you're talking about the two nervous system, so when one gets angry, is that when the sympathetic system kicks in?
Yes. So angry, also we feel some dangerous, yes? We feel something.
That suddenly sometimes you see people get angry and then they get more agitated, more angry, and then it gets out of control. So
Exactly.
is that that system, yeah, sympathetic?
Exactly. So it's this will activate the sympathetic, or it's a part of activating the sympathetic. The reason can be from outside, or from inside. If your blood sugar is not normal, you will go more for that. If you get used to be more sympathetic from nervous system, more always angry, always hot mood, then your sympathetic nervous system will be the default, the main one. So you will keep, you see many people, they are angry for no reason.
Short fuse.
Yeah, for small, because their sympathetic nervous system became the main one, the default one.
Yeah, so that's why when we are advised, like in Islamic, to say that if you're standing, you're getting angry, sit down, or go and do wudu, which is really
that you
disturbing your system. Yeah.
Yeah, when you do that, you walk, you will keep your like mindfulness. You will take your mind for something else, to make wudu or make something else. Your attention will be for something else. So this is part of mindfulness.
Thank you.
Yeah.
Anyone else has got a question for Doctor before we finish?
Thank you, Doctor, very much.
Thank you.
You know, yeah, it's been incredibly. This time it worked much better. So thank you so much, and thank you for giving us your precious time. And inshallah, we'll get you on again in the future if you agree.
Of course.
Yeah.
Pleasure for me.
Thank you very much.
Thank you. Thank you,
That was a
Doctor.
lovely lecture, Doctor.
Right. Thank you, Doctor. Thank you, Afzal, as a presenter. Thank you very much.
Alhamdulillah.
All right.
Inshallah.
I'll put
with me in your dua.
Thank you. Thank you for the lovely tips, Doctor.
Thank you, Salim, for your recitation of Yasin.
I am your servant. I am your servant. But this tip about fasting was very good. Because I'm an Uber driver, it's been difficult for me, but I will try and do this.
I do it actually.
I think it's I think when I got a cancer as well, so I've been asked by the cancer specialist to do a 16-hour fasting.
Yeah, it has a great effect.
Yeah,
the treatment, it has a prophylaxis for cancer, and even when you have it, it will help the like medication, because it has what called autophagy. It will destroy the weak cells, including even the cancer cells.
And even Chinese, they use it. Thank you very much. Thank you.
Even you can apply it as you are driving. apply, like make the eating period for your work and
Yes.
the rest, and you will not have problem. But the begin, make it maybe not in your work day, in your like free day, weekend or somewhere. Then you will, it will be easier for you. Just the third day, 3 days, first 3 days will maybe a little bit difficult. Then, or you can fast just in the beginning 14 hours and eat for 10 hours. This is, I think, much enough.
Okay.
Thank you, Doctor.